Hey yo, it's your boy Peter, and today we'll be talking about the dreaded coronavirus. Well, it's very important that we know about this virus, and we also should know that the coronavirus are a large group of viruses that have been with us for a very, very long time, responsible for our common cold, the flu, with symptoms of runny nose, sore throat, and fevers, and the rest of them. But then there are some times when we have mutations in the genetic components of these families of viruses, and then they come up as very, very deadly viruses. And that is what we really want to know about the present coronavirus, known as the nCoV for short, or 2019 nCoV for short. So it's important we know so that we could take adequate measures towards the prevention of spread of this virus. And as we know that there are many cases now that have been reported in the United States and even in the Ukraine, and of course spreading all around China. So it's important we know about this virus. So let's get right to it. The coronaviruses are a large family of viruses, like I said before, that can cause respiratory illnesses such as the common cold, according to the Centers for Disease Control and Prevention, the CDC. Most people, though, get infected with coronaviruses at one point in their lives, but symptoms are typically mild to moderate. In some cases, the viruses can cause lower respiratory tract illnesses such as pneumonia and bronchitis. These viruses are common amongst animals worldwide, but only a few handful of them are known to affect humans. Rarely, though, coronaviruses can evolve and spread from animals to humans. This is what happened with the coronaviruses known as the Middle East Respiratory Syndrome coronavirus, MERS-CoV for short, and the Severe Acute Respiratory Syndrome coronavirus, SARS-CoV for short, both of which are known to cause more severe symptoms, as we all remember about the SARS problem some few years ago. So, how many people have the virus now? Well, as of Sunday, a few days ago, there are more than 2,700 confirmed cases and at least 80 deaths linked to the 2019 nCoV virus, according to the New York Times. Sunday evening, the CDC announced 2 more U.S. cases, one in Los Angeles County, California, and another in Maricopa County, Arizona. Early Saturday, the third person in the U.S. was also affected. This one in Orange County, California, was reported to have tested positive for the new coronavirus. According to the county health department, the person had traveled from Wuhan and was in good condition, the Times reported. The second person in the United States, a woman in Chicago, was confirmed to have the virus on the 24th of January. And the first case was confirmed in a man in Washington State on the 21st of January. So far, all of the infected individuals in the United States had also recently returned from Wuhan, China. The first presumptive case of the novel virus has been reported in Canada in a man in his 50s who had returned from Wuhan, China to Toronto, the Times also reported. So we want to know how far this virus has spread. Well, based on what I had said before, the first cases of the pneumonia-like virus were reported in Wuhan, China on December 31st, 2019. Since then, the virus had spread to various other countries, including Thailand, Japan, the Republic of Korea, and the United States, Australia, France, Taiwan, among others. On the 25th of January, which was a Saturday, a presumptive case of the virus was reported in Toronto in a man in his 50s who had visited Wuhan, China. While Portugal's health ministry says they are watching a patient in Lisbon for the virus, the patient also had recently traveled to Wuhan, the Times said. The first US case was confirmed on January 21st in a man in Washington state who had recently traveled to Wuhan. On January 24th, officials confirmed a second case in a woman from Chicago who had also recently traveled to the Chinese city. Both cases were hospitalized but doing well, officials said. There are now 5 confirmed cases in the United States. The CDC is also investigating 110 people from 26 states for a possible infection with the new virus, officials said Monday. That was the 27th of January. 32 people under investigation have tested negative for the virus. So, where did this virus come from? Since the virus first popped up in Wuhan, in people who had visited a local seafood and animal market, officials could only say it likely happened from an animal to humans. In a new study, however, researchers sequenced the genes of the 2019 nCoV, as the virus is now called for short. And then they compared it with the genetic sequences of more than 200 coronaviruses that infect various animals around the world. Their results, detailed in the Journal of Medical Virology, suggested that the 2019 nCoV likely originated in snakes. As for what kind of snake, the scientists noted that there are 2 snakes that are common in the southeastern province of China where the outbreak originated. The many-banded krait, known as the Bungarus multicinctus, and the Chinese cobra, Naja atra. However, some experts have criticized the study, saying it's unclear if coronaviruses can indeed infect snakes. So how did the virus hop from animals to humans? Well, some viruses are known to become capable of transmitting to humans, and this coronavirus is one of those. But how? The study published in the Journal of Medical Virology, revealing the likely snake host, also found that a change to one of the viral proteins in the 2019 nCoV allows the virus to recognize and bind to receptors on certain host cells. This ability is a critical step to entering cells, to viruses entering cells. And the researchers said that is the change in this particular protein. So the change in this particular protein may have helped the virus to hop into humans. Because viruses usually have protein structures on their cell wall that allows them to fuse with the proteins on the human cell wall and then inject whatever it is that they contain, or get their genes or get themselves into the human cell. So, can the virus spread between people? Well, of course, yes. In limited cases, according to the CDC, but the primary mode of transmission seems to be from animal to human. In terms of how one would catch the virus, the CDC says that the human coronaviruses are most commonly spread between an infected person and others through the air, from viral particles, or from a cough or a sneeze, close personal contact, touching or shaking hands, an object or surface with viral particles on it, then touching your mouth, nose, or eyes before washing your hands. So it's very important to wash your hands. And rarely from fecal contamination. So it's possible from fecal contamination, but very rare. So how would this virus cause a pandemic? In order for the virus or any to lead to a pandemic in humans, it needs to do three things: efficiently infect humans, replicate in humans, and then spread easily among humans. And right now, the CDC is saying that the virus passes between humans in a limited manner, but they are still investigating this fact. As of now, no instances to human transmission have been identified in the United States, CDC officials announced on January 27th. An individual's risk of infection depends on exposure, given the low number of confirmed United States cases. The CDC has determined that Americans' risk of the 2019 nCoV infection remains low at this time. So it could increase, So how does the virus compare to SARS and MERS? MERS and SARS have both been known to cause severe symptoms in people. It's unclear how the new coronavirus will compare in severity, as it has caused severe symptoms and death in some patients, while causing only mild illness in others, according to the CDC. All three of the coronaviruses can be transmitted between humans through close contact. It's unlikely that imported goods from China could carry the new virus, as coronaviruses don't typically survive on surfaces for more than a few hours, CDC officials said on the 27th of January. MERS, which was transmitted from touching infected camels or consuming their meat or milk, was first reported in 2012 in Saudi Arabia and has mostly been contained in the Arabian Peninsula, according to NPR. SARS was first reported in 2002 in southern China. No new cases have been reported since 2004, and is thought to have spread from bats that infected civets. The new coronavirus was likely transmitted from touching or eating infected animals in Wuhan, or eating an infected animal in Wuhan. During the SARS outbreak, the virus killed about 1 in 10 people who were infected. The death rate from 2019 nCoV isn't yet known, although most of the patients who have died from the infection have been older than 60 and have had pre-existing conditions. So, in other words, it's in combination with an existing disease, this could actually further weaken the immune system and lead to more complications, which can lead to the death of the patient. And also, when we look at older people to an extent have a weakened immunity. So a weakened immunity plus this kind of virus coming in could pose a whole lot of stress and could complicate with death of the patient. So more recently, a young healthy man died though in Wuhan, China, raising concern that the virus might be more dangerous than thought, according to the Washington Post. So even when we actually think that some things may be avoided, it doesn't actually mean that there can be a weird twist to it or an exception. So for the fact that a particular disease is known to only affect a particular group of people based on age or ethnicity or race, it wouldn't just select this group of people. There is always an exception. Of course, it will be much more preferential towards the particular age or group or race or genetic predisposition or whatever. But then it can also affect people who are not known to be affected by such diseases, so to speak. I guess that's really understandable. So the symptoms of the new coronavirus and how to treat it. Symptoms of the new coronavirus include fever, cough, difficulty breathing, and it could also come with headache. And those normal flu-like symptoms. These symptoms are similar to those caused by SARS, according to a recent study published in the Journal of Lancet. Despite sharing some symptoms that were similar to SARS, there are some important differences, such as the absence of upper respiratory tract symptoms like runny nose, sneezing, and a sore throat. Wow. We had actually said that the group of coronaviruses would present like this, but also there is a twist to this, because it may not really present exactly like this, but does not mean that these are not similar to the general flu-like symptoms. It actually also depends on the type of virulence factor that this particular coronavirus has and the way it infects. So in this case, the absence of upper respiratory tract symptoms is what is really kind of peculiar to this, but does not actually mean that we should rule out upper respiratory tract symptoms in patients who present with it as it not being the coronavirus. Like, it's actually very important that we still try to test for the coronavirus in people that present with upper respiratory tract symptoms, as well as similar symptoms to what we might connect to the infection of the coronavirus. So here, in this case, the runny nose and the sneezing and the sore throat and intestinal symptoms like diarrhea, which affected 20% to 25% of SARS patients, led to Arthur Bin Kao from the China-Japan Friendship Hospital and the Capital Medical University, both in Beijing, said in a statement. There are no specific treatments for coronavirus infections, and most people will recover on their own, according to the CDC. So treatment involves rest and medication to relieve symptoms. A humidifier, a hot shower can help to relieve sore throat and cough. So these are the upper respiratory tract symptoms that also come with it. If you are mildly sick, you should drink lots of fluid and rest. But if you are worried about your symptoms, you should see a healthcare provider, they wrote. This is advice for all coronaviruses, not specifically aimed towards the new virus. That's this new coronavirus we have as a problem now. So, therefore, there is no vaccine for the new coronavirus, but the researchers at the United States National Institutes of Health confirmed they were in preliminary stages of developing one. In addition, the drug company Regeneron announced that it is in the early stages of developing a treatment for this virus, according to the NBC News. New diagnostic protocols to test for the virus are now available online, and test kits will be distributed to medical centers in the US and abroad sometime in the coming weeks. CDC officials announced on January 27th, that was a Monday. Within the US, the CDC is coordinating with the state health departments to determine which patients should undergo diagnostic testing and to be placed under surveillance. So, what is being done to stop the spread of this coronavirus? The Chinese government has stopped most of the travel to and from Wuhan, China, as well as 12 other nearby cities, according to the New York Times. This lockdown affects about 35 million people, the Times reported. On Sunday, Taiwan's government announced that they would not allow in anyone from the Hubei province. The Times also reported this. Also on Sunday, the Hong Kong government announced it would bar from entering the city residents of Hubei province or anyone who had visited the province in the prior 14 days the Times stated. Major airports in the United States are conducting screenings to try to check for the symptoms of the virus. However, there is evidence that the virus can spread before a person shows symptoms. As such, United States officials said on Friday, January 24th, that they are currently re-evaluating the effectiveness of the screening. On January 27th, CDC officials said they may consider broadening airport screening and updating their travel recommendations for Americans. I expect in the coming days that our travel recommendations will change, said Dr. Nancy Messonnier, director of the CDC's National Center for Immunization and Respiratory Diseases. As of Sunday, January the 26th, the Chinese government had banned the sale of wildlife in markets, restaurants, and online. The Chinese government's announcement on that particular day to temporarily ban the sales of wildlife in markets and restaurants and over e-commerce needs to be permanent. So, we congratulate the government for taking this important first step, Christian Waltzer, Chief Global Veterinarian for Wildlife Conservation Society, said in WCS statement. The banning of such sales will help end the possibility of future outbreaks of zoonotic diseases, such as the Wuhan coronavirus. We learned this lesson with the outbreak of another zoonotic disease, SARS, in 2002. The pattern will keep repeating itself until we ban, not only in China but in other countries, the sale of wildlife, especially for food and in food markets, Waltzer added. The CDC also recommends avoiding non-essential travel to Wuhan, China on January the 23rd. The U.S. State Department also ordered all non-emergency U.S. personnel and family to leave Wuhan, China. The department said in a statement that they actually want all the non-emergency U.S. personnel and family to leave, just to control the spread of this virus, and also to protect their citizens in this area. So what to expect in the coming days? Well, looking at what happened with MERS and with SARS, it's likely that some spread of the virus from close contact between humans will continue to occur, according to the CDC. More cases, possibly including some in the US, will likely be identified in the coming days. In a statement released on Sunday, the CDC said it is likely that there will be more cases in the US in the coming days and weeks, likely including person-to-person spread. In previous outbreaks with MERS and SARS, the two other coronaviruses that have jumped the species barrier to cause severe illnesses in people, person-to-person spread has been seen, including among healthcare workers caring for patients ill with coronavirus infection. So how can people protect themselves and others? If traveling to Wuhan, China, you should avoid contact with sick people, avoid dead or alive animals, animal markets or products that come from animals, such as uncooked meat, according to the CDC. You should often wash your hands with soap and water for at least 20 seconds. Yeah, 20 seconds. They wrote, if you are infected by the virus, you can take steps to help avoiding transmitting it to other people, such as isolating yourself at home, separating yourself from people in the house, wearing a face mask, covering your coughs and sneezes, and washing your hands. So people who travel to Wuhan and became sick with fever, cough, or difficulty breathing within the following 2 weeks should seek medical care right away and call ahead to inform medical staff about the recent travel. It's very important. So the ways to actually prevent the coronavirus from spreading still includes the normal ways we should prevent ourselves from all other forms of respiratory diseases, viral diseases, bacterial diseases, and it's actually really simple. Isolation, washing your hands, and not going to places that are known to spread these viruses, like animal markets and the rest. Once an information has been made about the spread of a virus, probably from animal to human contact, it's very important that people should take note of this, because that is one major area where people don't really listen and where people can actually get this virus. So once they can listen to the aspect of not going to animal markets or avoiding them, the rest of the prevention measures are easier, like washing your hands and try to isolate yourself from people and just maintaining your normal sanitary measures or practices. So it's very important that we know this. So in the coming weeks, as more news comes about this virus, of course we would be able to give more information and to educate ourselves further. So thank you so very much for listening to this long podcast, and do have a great day ahead. Please like, share, and subscribe.